Okay, this talk is chapter 22, which is about rural health and migrant health. And migrants often work on farms, work as migrant farm workers, and so that's why they're put together. So we're going to discuss access to service, which is a real issue for these rural underserved populations. We're going to define migrant farm worker, and we're going to explain the role of the nurse working with these two vulnerable groups. So the big question is what major factors affect the health of rural residents, and what is a migrant worker, and what are the major factors affecting migrant workers. So the issue, a big issue to rural health, is access to health care. It's the scarcity of health professionals living out and providing services into underserved areas. Poverty is related. Farmers are often in debt, paying for high expensive machinery and waiting for subsidies for their produce, being subsidized to not produce different products, and so they are not rich farmers. They have limited access to services, they have a lack of knowledge, and there's a type of social isolation that they have because they live so far away from their neighbors. I will put RHI Hub Rural Determination up in Canvas so you can take a look at that and see what that means. The government determines what is a rural area. So we have a higher than average number of younger residents living out on farms and older residents. Older farmers, widows, that are remain living on their farm, seeing the farm as very valuable, not wanting to give it up, but living alone if the spouse has passed. They have fewer years of formal education. They tend to go out of high school and onto the farm. Some do go to college for agricultural programs. They tend to be poor again and are very high risk for being uninsured or underinsured. And this is where the Affordable Care Act became very valuable for farmers. They have a very poor perception of their own health and their functional status. They are less likely to engage in preventative behavior. Have you seen the farmer's tan where they aren't putting sunscreen on their arms? Their arms are getting burned, their faces are getting burned, their heads are getting burned, and when they're out in the sun all day. They're more likely to have one or more of the following chronic conditions. This is more likely than urban dwellers. And so heart disease is big, COPD, because of the chemicals and the dust and the fungi that they're exposed to, hypertension, arthritis, and rheumatism, diabetes, cardiovascular disease, and cancer. Some of that because of their exposures, and some of that because of lack of ability to get to physicians and nurse practitioners to control it. They tend to have poor health overall and are less likely to seek medical care. Part of the issue is the travel time, and we looked at Google Earth when we saw that town in California that was a little town, but had to travel far away to get an MRI or to get an X-ray. And they have to milk the cows, they have to run the farm. They don't have a lot of time to sit waiting for a test or drive out 50 miles to get services for preventative care, mammograms and things like that. So the 5 leading causes of death for rural people are heart disease, cancer, chronic lower respiratory disease, unintentional injury, and stroke. And so we've talked about the primary prevention of these. We've talked about the screening necessary for these. And we've talked about the tertiary follow-up. You do the tertiary with your hospital care and with home care. And so, stroke rehab and cardiac rehab and hospice services. These all become very important services that nurses can provide in this area. So there is HPSA areas, health professional shortage areas, know this term. Typically pediatrics, OBGYN, and some of the other specialties. You're not going to find an orthopedic doctor in the middle of, Hip Joe, Pajoe, Pennsylvania. They're just not setting up practices in those areas. They do, we see Children's Hospital in the suburbs in Montgomery County and Bucks County, but they would have to travel in from there. We also see, though, that Jefferson is expanding. I think the Penn system is expanding to Lancaster. They're buying the hospitals in rural areas, and then providers will go there 1 day a week. But OBGYN and Peds is particularly difficult. And so people have to drive when they have to deliver their babies, when their children are sick. Barriers to care for the people who are in rural areas. The care is not available. It's not affordable if they don't have insurance. It's inaccessible in that it's not easily gotten to, or it's unacceptable services and professionals who are not available for 24 hours. And some professionals have attitudes about working with rural people. They don't have the insight and the knowledge needed to deal with the issues and problems of people who are from rural areas. It is a special culture that we need to look at. So I will put this link on Canvas so you can look at the rural health professional shortage areas that are listed, and then what needs to change. So this cross-state line practice. We have compact states. Pennsylvania is not part of that, where nurses' licenses can cross states without having to get a special license for that state. So Delaware, Virginia, and Maryland are compact states, so that if you got your license in Maryland, you can easily practice in Virginia by showing your Maryland license. You could easily practice in Delaware. This helps to open up practice for nurses, helps nurse practitioners to go into areas much easier than having the burden of the cost of professional licensure. Allowing professionals to fully use their skill, practice to the full extent of their license and training, meaning that nurse practitioners are educated and skilled to provide wound care, to provide bone setting, to provide those lower level skills, but still highly skilled services that people may need from those unintentional injuries that are plaguing them, or from diabetes care. Allowing nurse practitioners full licensure to write prescriptions becomes very good. And then this change of policy again is the same, allowing nurse practitioners to do things that physicians typically do, but since they're not in the area, nurse practitioners will take over. Okay, so again, school nurses are needed in rural areas, family planning services, prenatal care are needed, care for families with patients who have AIDS, emergency care services. Imagine having to drive 50 miles to the emergency room when you're having chest pain. Are the ambulances coming out? Are they BLS ambulances? Are they not advanced life support so that they can get to that person on the farm and then have enough time and enough service in that ambulance to take them to get higher services that 50 or 60 or 100 miles away where the hospital is. Children with special needs have issues in the communities, being isolated, and these special services are expensive. They are a cost outside of what the school typically gets, and so the school may not have those services, and so children would not get served or would have to live away from their family. Mental health services are lacking in rural areas. And then services for older adults. Meals on Wheels is much harder when you have to drive 10, 15 miles between each patient. But there's great need when we saw that there's a lot of widows and widowers living alone in their homes on the farms. Mental health issues include delay seeking care. They put it off. Depression hits hard for the families. The poverty, the isolation, and then the lack of knowledge of need for seeking services. Domestic violence can be an issue that can go along with the frustration of poverty, and also can go along with issues of isolation. And then alcohol, tobacco, and other drug use and abuse are issues. Uh, these are long-term issues. We've seen that where families, grow their own tobacco. They distill their own alcohol. Meth labs are hidden out in rural areas, but also just from the depression, the boredom, the lack of other activities may fall into abuse of alcohol, tobacco, and drugs. There are a lot of environmental issues related to working in rural areas. If you can imagine forestry and mining and fishing and agriculture, which are out in isolated areas, but they're also very dangerous. You can imagine the saws that they're using. Mining is very dangerous with the dust, the danger of explosions, and the danger of the big drilling machines and carts moving heavy coal, very dangerous. Fishing with slippery conditions and hooks and nets and being taken off the boat, things like that. Agriculture, again, pesticides, big machinery, inability to see, and then rolling over people who are in the fields. There's a lack of OSHA regulation for farms and ranchers, the ranchers being the cowboys that move the cattle and sheep. And so the Occupational Safety and Health Administration we're going to talk about with occupational health nursing, but there's just no regulations that say your workers must have these masks and your workers must have skin protection and eye protection and things like that. There's a lot of common injuries of cuts and exposures to chemicals, pesticide exposure. So there is a lot of danger on farms. So I'm going to stop there, and I'm going to talk about migrant farm workers in the next section.